everyone! Good day! I'm Marley A. Abichuela, Teacher 2 from Claudio Villahen Elementary School, Labo, West District, Labo, Camarines Norte. We are in Group 5. This is the continuation of the report about the quantitatively oriented data collection designs. But before that, I have prepared questions related to my topic. But I want to focus first on the example of the reading program of the Department of Education so we can better understand before proceeding to my topic on the factors affecting evaluation decision, especially related to a reading program for struggling readers. For number 1 question is, what is the most important thing to consider when selecting an evaluation design for a reading program? A. The number of books available. B. The evaluation design itself. C. The student's interest in reading, or letter D, a teacher's preferences. So the answer is letter B, the evaluation design itself. Why? Because the evaluation design determines how we measure the success of the reading program. It should be carefully planned to assess whether the program helps struggling readers improve. Example, if the school introduces a new reading intervention, the design might involve comparing the reading levels of the struggling readers before and after the program. For example, DepEd has assessment tool for grade 1 to 3, the CRLA or CARLA, and for the grades 4 to 6, the RLA, which helps teachers identify if the student is at the emergent, developing, transitioning, or grade-ready reading level. So, yung comparison of pre-test and the post-test results help in assessing progress. Okay, for number 2, why might a random selection of students be difficult in reading program for struggling readers? A. All the struggling readers must be included. Letter B. There are not enough books. Letter C. Students do not like reading. Or letter D. There is no need for a control group. So the answer for number 2 is letter A. All struggling or full pressure readers must be included. Why? Because in a reading program, aim at helping struggling readers. So, it may be necessary to include all the students who are behind in reading, rather than selecting only some students randomly. For example, if the student identifies 30 students who are significantly behind in reading, they may decide that all 30 should join the program, making it impossible to randomly choose some students for a control group. All 30 students need to be addressed. Number 3, what can prevent finding enough participants for a reading program evaluation? A. Lack of student interest in reading. B. Project, program cost, and staff training. C. The school has too many students. And letter D. The students have no reading materials. So the answer is letter B. The project program, cost, and staff training. Why? A reading program may require special training for teachers or specific reading materials, which can be expensive. If there is not enough funding, it may be hard to find enough trained staff or resources to run the program effectively. Example, a new reading program might need teachers to learn specific strategies for teaching struggling readers. If the school cannot afford the training, only a few teachers may be able to participate, limiting the number of students who can benefit. However, DepEd has now incorporated reading strategies into monthly LAC session, so allowing teachers to receive training without additional cost. And we have also the inset sessions can also focus on strategies for reading instruction. Okay, number 4. How can parents influence which students join a reading program? By deciding if they want their children to participate. B. By donating books. C. By choosing the reading materials. And letter B. By organizing reading session. So what will be your answer? The answer is letter A. By deciding if they want their children to participate. Why? So parents can decide if they want their children to participate in a reading program. If they think the program will help, they may encourage their child to join. If they are unsure about its effectiveness, they may refuse. Example, in the National Learning Camp, participation was voluntary, but some parents of struggling learners refused to let their children join, so affecting the program's success since not all the students who needed help participated. Okay, for number 5, why are reading programs that require big chances harder to accept? A. They take more time to show results. B. Big changes can cause parents and teachers to resist. Or letter C. They cost more money. Letter D. They involve fewer students. What will be your answer? Yes! The correct answer is letter B. Big chances can cause parents and teachers to resist. Why? In a reading program that asks for major changes, like altering class schedules or teaching method, may face opposition from parents or teachers who prefer to stick to familiar routines. This resistance can lead to the program being modified or even cancelled. Example, if a school introduces a reading program that requires students to read for an hour every morning, replacing regular classroom time, some parents and teachers may feel this takes away from other subjects. This resistance can reduce participation in the program. In some schools, they implemented a remedial reading session before dismissal for students struggling with reading. Now, you have the background about my topic. The factors affecting the selection of evaluation design, we have 4 factors. The first one is the scope of the treatment. Second, the project or the program purpose. Number 3, the concerns of parents. And number 4, is the extent of treatment. Now, let's proceed to the first factor, which is the scope of the treatment. In some situation, it prevents optical evaluation design. Example of the scope of the treatment is the total coverage of all the students in the treatment group. However, if those are involved in the program, you may get a contrast group from the other school. Or when we say contrast groups may need to be formed using external schools or system. That we need to consider in the scope of treatment for the project cost, the staff preparation, and resources limitations can hinder the design's option. So this scope of the treatment may limit the use of an ideal evaluation design. Sometimes, all the students need to be included in the treatment group, meaning there is no control group. This makes it harder to assess effectiveness using traditional randomization or control group method. Other challenges include cost and trained staff availability. In a national reading program aimed at improving literacy for all grade 1 to 3 students, might not select a control group because every student is meant to benefit. So hiring reading specialists or volunteers or Brigada Pagbasa volunteers and trainings all teachers can also be costly. So for the second one is the project or the program purpose. The program purpose influences the design decision. So this is the program solving local or specific problems may lead to an increase in participant. The perceived success or the value of the treatment or bandwagon effect may affect the selection of contrast groups. So the differences between the classroom, the system, or the school in problem areas complicate contrast group formation. So in this factor, the purpose of the program influences the evaluation design. For example, if it targets a specific district with low literacy rates, the evaluation focus on the student needing the most help. So success can lead to a bandwagon effect or the control group, but a school with different challenges might not need different treatment. Example, in a rural area with low literacy rates, may design a program especially for those school, which might not be suitable for the school with higher literacy levels. Okay, for number 3, we have the concerns of parents. So we have the parent support or opposition influences student participation. And also we have the high potential for success may lead to widespread demand for participation, or the high potential for harm may result in lack of participation. In explanation for this concern of parents, so yung parental concerns can impact student participation. So the parents might support or resist a program depending on their perception of its effectiveness. For example, sa new method of reading instruction, cite some parents while others may worry about confusion, so affecting the students' participation. Okay, now let's proceed to number 4, the extent of treatment. In the extent of treatment, the extent of changes in a program can significantly influence its acceptance and participation. The programs involving only minor adjustment to routine are more likely to gain support, while those requiring major changes may face resistance, potentially causing the program to be altered or even so in this extent of treatment, the level of change required by the program affects its acceptance. So, yung small changes are easier to implement, while the bigger changes may face resistance. Example, adding 15 minutes for reading time is easier than requiring student to stay after school for an hour. Okay, now selection of evaluation design is influenced by multiple factors, including program, scope, purposes, the parents' concerns, and the extent of treatment. So, yung practical and political realities often limit the ability to use the ideal evaluation methods. And for the administrator, must weigh the potential risk and benefits to participants when making design decision. So, in the practical considerations such as funding, yung staffing, and time constraints can limit the evaluation design. So, the political factors, including the school or the government policies, may also affect the program. For example, if a program has strong political backing, it may be rolled out quickly without proper evaluation structures in place. On the other hand, a lack of political support could limit its scope and impact. Example, if the reading program is a top priority of the Department of Education and is being pushed by rapid implementation, it may be difficult to set up a comprehensive evaluation, such as using control groups or long-term follow-ups. In this case, political pressure to show quick results might limit the ability to properly assess the program's impact on struggling readers. So, in designing an evaluation for the Department of Education reading program for the struggling readers, the decision to use a randomization or control group must consider factors like the scope of the program, the purpose of the intervention, the parental involvement, and the extent of the treatment, and practical or political constraints. So, these factors play a critical role in shaping how the program can be evaluated and how effective the program will ultimately be improving student literacy outcome. Okay, thank you very much. And I hope you learned from the topic. And once again, I'm Merly A. Abituela from Claudio Vilhen Elementary School, Labo, Camarines Norte. Thank you and bye-bye!